Hello, my name's Joyce Harper and I'm Professor at the Institute for Women's Health at University College London. And in this short video, I wanted to talk to you about infertility and the treatments that we can offer the infertile couple. Now, the World Health Organization defines infertility as when you've been trying to have a pregnancy after 1 year and not achieved it. So if you've been having regular sexual intercourse around the time of ovulation for more than a year with no success, that's the definition of infertility. But it does depend on the age of the woman. So I would recommend that a woman under 35 might want to try for a year, but anyone over 35 should not leave it too long before they might want to get some help with seeing if they have a problem. So if you're over 35, you might just want to try for about 6 months before you go to a fertility clinic or to your doctor to have further tests. So if you are having problems, the sorts of tests that will be done when you visit a fertility clinic are, first for the man, we check the sperm to check that there's sperm there, they're of good morphology, they're swimming in the right direction, and that there's a good number of them. So that's really quite a straightforward test. For the woman, we would start by doing some hormone tests, and we would check some of the key hormones to see if there are any effects on her menstrual cycle and her fertility. As a woman gets nearer the menopause, her hormone profile will change. As she gets nearer the menopause, it will be harder for her to get pregnant. A woman would also obviously be carrying the baby, so we need to check that her womb is okay, and there's a number of methods that we can use to do that. But it's also useful to check whether her fallopian tubes are open. So when you have intercourse, the sperm is deposited at the top of the vagina. The sperm swims through the cervix, up through the womb, and down the fallopian tubes, where the egg should have been deposited at ovulation. And the two will fertilize there and then travel back down the fallopian tubes into the womb, where they will implant, hopefully. So the fallopian tubes are needed if you're going to try and conceive naturally, or if you're going to use some of the procedures we use in the fertility clinic. So that can be done by a really simple procedure, by just injecting some dye through the fallopian tubes and checking that it comes out from the end of the tube. So if we've done these tests and they're all clear, then the couple can decide if they want to embark on treatment or keep trying naturally. But if we find out that the tubes are blocked, or if there's some other issues, then the couple may want to embark sooner on fertility treatment than later. And the very easiest type of fertility treatment that we do, if the tubes are open, is just called intrauterine insemination. We take some of the sperm, we prepare it in a special way, and we inject it through the cervix into the top of the womb. So this means that the sperm doesn't have to travel so far as it would naturally. It's now being deposited almost at the place where it needs to be to meet the egg. It just has to swim down the fallopian tubes to meet the egg. And also, if we're using donor sperm, this is the very simple way to introduce donor sperm into the woman. Now, if intrauterine insemination doesn't work, then the couple may decide to embark on full in vitro fertilization. And for this, we would normally give the woman fertility drugs so that she produces more than one egg. And the data has shown that the more eggs she produces, the better her success, at a level of around 12 to 15 eggs. If we get more eggs than that, it can mean that the woman was what we call hyperstimulated, and this can cause problems, but your clinic will tell you all about that. So we will monitor the woman's treatment so that we can check how the eggs are developing, and after a few weeks of fertility drugs, we will then be ready to collect the eggs. So the woman does have to go through a small surgical procedure. It's normally not too much to worry about, and the eggs are collected and they're kept in the laboratory, and then they can be mixed with the sperm. The embryo development is monitored, and then the embryologist will normally pick one embryo to transfer back into the womb, and hopefully will freeze any other good quality embryos for use at a further time. Now, if the man has a very low sperm count, it is possible for us to do a procedure called ICSI, or intracytoplasmic sperm injection. And in this, the embryologist will pick up one sperm at a time and inject this directly into the egg. And this is shown to have equally good success rates as IVF and can help those men that have very low or very poor sperm. But we can also help men who actually have no sperm in their ejaculate. It may be possible for us to aspirate some sperm from the testes and use that to inject into the egg and achieve a viable embryo and a pregnancy. And there's a number of techniques that can be done depending on the problem the man has. So IVF has really come a long way since its 40 years of its first success. The first IVF baby, Louise Brown, was born in 1978, and there's now been about 8 million IVF babies born worldwide. So the technique is very successful, and we really hope that you can use this technology to have the family that you want. Thank you.